All right, so just want to let you know, number one, I'm Michael McNutt, the Director of Education and Events for WEDI. Pleasure to have all of you join us. Let's go around the horn. I will start with David, who's going to be our moderator for the session.
Thanks, Michael. I'm David Haugen. I work for the Minnesota Department of Health. We have a focus on some administrative simplification that I'm in charge of. And then I've been a WEDI board member for about 3 years, and also one of the members of something that we're calling the Automation Task Force. And so very interested in learning a little bit more about your take on automation to improve the patient experience, and also to just be thinking out loud with you about the best way to tell those stories and engage the audience, and maybe some questions that might be a little bit provocative, and give us all something maybe to be thinking about further, knowing that this isn't really intended to be a kind of one-off session, but really the start of really thinking about this maybe in some new and different ways. So thanks, Michael.
Thank you, Dave. Gerard, we'll go with you next.
Yeah, Jared Eula, I'm the CEO and founder. Can you guys hear me okay?
Perfect.
Sure.
All right, cool. Yeah, so Jared Eula, CEO and founder of Health Talk AI. And at Health Tech AI, we really founded the company to just do what you're talking about, David, and that is really fundamentally change the way providers and patients connect. So our job really is to identify gaps in care for providers and make it easy for patients to create their own encounters when they need to. And so kind of interested in this opportunity to kind of learn from what's happening, what other people are doing, and also kind of obviously tell our story and how we're making a difference. So nice to be here.
Thank you, Jared. Jaffer, we'll have you go next. Center square, in my view.
Sounds good. Thank you. Yeah, Jaffer Trace, Chief Operating Officer at Bertha. Of course,
the audio is breaking up
across the country. And we have, all right. How's this? A little better?
You're still underwater.
All right, dial in instead here and get off the Wi-Fi.
Okay. While we're waiting for Jaffer to jump back on, Vivian or Todd, if you'd like to introduce yourselves.
Hi, this is Todd Rogers, CEO of HealthX, and we're one of the largest health information exchanges in the U.S., and we're based out of New York City, and we cover New York City, Long Island.
Excellent. Thank you very much. Let's see, hope for Jaffer can jump on and he can offer his introduction.
Is this a little better now or no?
Better.
Okay, great. Yes, Jaffer Trace, Chief Operating Officer at Bertha, social care platform and network serving the nation, about 360 customers, and our focus is on free and reduced cost services with our integrations and platform.
Okay, great. Everyone's here. Just to continue to give you some background information on the event. The Summer Forum, your session takes place July 27th. Session is 12:45 to 1:45 Eastern Time. Okay. And all the parties, with the exception of Dr. Kafur Ovid from Navina AI, are present. So just to kind of give you, once again, kind of repeating the July 7th email, the idea of this really came a couple of months ago. We had a speaker for our May conference talking about artificial intelligence, Steve Waldron from the American Association for Family Physicians, talking about artificial intelligence at the doctor's office, and how AI is kind of the way we are adopting, the new technology we are adopting to increase and better the patient experience. So coupled with that, while putting together the Summer Forum, we came with the theme of fixing the knowledge/data supply chain, which was given to us by John Zimmerman from Hold On Solutions. So in order to do that, we looked at kind of this three-prong attack. And what WEDI Summer Forums typically do is focus on a particular item and offer maybe a deep dive or a little more concentrated attention to it. So we broke the 3 days into 3 separate elements that could hopefully fix the knowledge data supply chain. Day 1, automation. Day 2, patient data liberation. Day 3, federal regulation. So day 1 is automation. So looking at, this is the meat of that day. These two sessions back to back, one looking at the back of the office, those organizations that are leveraging automation that way, and this group that we have here looking at healthcare automation at the point of care. So the initial format is going to be, each of you will have your time to shine. Each of you will have your time to shine. 7 to 10 minutes, introduction. Dave will probably start off and kick off with, kind of an opening statement regarding automation. From there, and we can flip a coin. We can simply say who's going to go first, who's going to go second, etc. Where you're going to have the opportunity to introduce yourself to our WEDI audience and offer information, case studies, examples of what you're doing in terms of leveraging automation at the point of care. For Health Talk AI and Navina, just to once again reiterate, this is an educational based session. We definitely welcome you and welcome your subject matter expertise, but we definitely want to keep this very narrow in terms of our content and our objective, which is not to necessarily advertise said organizations or promote said organizations. So it's really more industry education. Feel free to offer a case study, your best case study you have yet, on what you're doing to leverage automation at the point of care. This will not have a question answer portion at this time. It's just going to be around the horn, first base, second base, third base, etc. Once we complete that, we have anywhere between 20 to 30 minutes to have an open discussion led by Dave regarding automation. How is it improving the patient experience and the benefits overall to the healthcare kind of workflow, the cycle of payers, providers, patients, etc. So at this point, any questions?
Yes, Jared, I have a question. So, it's difficult, we can bring up a case study, not a problem, but, in terms of, this is educating the public, the market on how these new avenues or these new technologies, is it okay to explain how it works, or you just want the results?
When you say explain how it works, is there anything unique that Health Talk AI is doing that others aren't? I mean, I guess, not to give away trade secrets or anything, but yeah, I mean, Dave, you can also help me as a board member. Like, there's a fine line between what we see as information and a commercial. And I understand, Jared, that you don't want to kind of cut yourself off at the knees and not explain how you do things. But Dave, if you could offer a little bit of background from a board perspective.
Sure. And so I think again, everything is always a balancing act. But again, this is an educational forum. And so people are going to need context to really understand the story. So I guess I'm in favor of providing the context that's necessary to keep the audience tracking and engaged and interested. To your point, Michael, if that context cannot take the form of an advertisement, that'd be the best way to go. But we do need some background. We need some context so that people really can be educated. That's sort of my feeling.
Does that help, Jared?
Yeah, I mean, I think would be helpful is, this is a new way to, using our bot technology to engage patients, is relatively new. I say relatively last couple of years. And so they may have engaged with us or, a competitor and not really realized it was that. So, I think it would be helpful to at least just discuss from a Health Talk perspective, just workflow, especially if these are providers. How does this fit into the workflow that we were able to drive the case study that we'll talk about? So I would like to talk about, if it's okay, a little bit of how it works in the workflow and kind of show, since we're talking about patient experience, like what does the patient experience look like, right? How does it feel? Before we get into the case study. Otherwise, I think it'd be difficult to understand how we got, and almost unbelievable, maybe, how we got to where we're at.
I think that sounds like helpful background. I assume you're going to be using some slides or something to help us, understand the points that you're making. If it would be helpful, I'm sure if you wanted to send the slides to Michael for any sort of comment or feedback,
Sure.
we'd be happy to provide that.
Sure, I can do that.
Yeah.
So
No,
I'll
that's
provide.
helpful.
Yeah, I'll provide. Yes, and would be slides. I wouldn't obviously. You said this. You don't want this to be a pitch. I wouldn't bring up a live demo or anything. I would just basically slides, and then quickly get to the case study and the results of the impact of what we're doing.
No,
So I can send that to Michael.
That's great. And I kind of love the context that you're talking about, just defining the patient experience. I think that's very valuable. And that might also put you in the number one spot. So because we would definitely want to define that as early as possible in this session. So thank you for definitely jumping in on that.
And Michael, if I can just kind of interject or try to elaborate a little bit from a board member perspective. I've been on the board of WEDI for like 3 or 4 years, and came to WEDI, I think, with what I think of as kind of the traditionalist view of WEDI, which was WEDI is the organization that really helped develop the implementation of the HIPAA transactions for a lot of the back office functions. And for a long time, I think that was kind of WEDI's forte and its real focus. The fact that we're looking up front at sort of the front part of this, as well as the back office part, in my mind, is a little bit new and different and exciting. And so I think to also be able to help reinforce or make the case for why it's appropriate to be looking at sort of both ends of the continuum is going to be important and helpful too.
Yeah, I don't want to take up all the time here, but I think, I didn't know that. And so that's some good education, right, in terms of HIPAA. And I think one thing we can bring out is that what we learned during COVID is, obviously the easiest part of our technology is the texting, but it's all via text. And what we learned is that, the sky didn't fall when we're texting patients. Actually, texting patients people actually like, but it's not all. Obviously none of it is HIPAA compliant. So how to be clinically relevant but yet HIPAA compliant, we can touch on that too when we talk about the patient experience. Since WEDI has that connection with HIPAA, right? So we're kind of also in this balancing act of engaging patients. So we can bring that up too. I think it's been a big learning in terms of that. So I'll be quiet now. I'm sure other people have other things to add, but thank you for asking my question.
No problem. Our pleasure. And then, like I said, it's just kind of an around the horn thing. Jaffer, definitely from a social determinants of health base, we'd love to have your insight as to how Aunt Bertha is leveraging, automation to help populations. So that would be kind of your 7 to 10 minute offering. Is there anything you'd like to add?
No, I feel pretty comfortable with it. Yeah, participated in these before. Really familiar with the approach, and so we'll probably have 2 or 3 kind of clean examples just to share in that regard. And no questions. Although I'll definitely share slides in advance.
Excellent. Thank you. Todd, you'll be coming from a health information exchange perspective. So you'll be unique in that, unique from Aunt Bertha, unique from Health Talk IE, and even Navina. So definitely talking about the various, and I know you've had a lot of initiatives in terms of automation that an HIE, from your unique perspective, has experienced, and also what you've been leveraging and executing in terms of AI and ML.
Yep. So we'll definitely be going over 2 or 3 different kind of use cases on that front. We'll have a couple background slides just to orient people what an HIE is, because that's still very much a question in some people's mind. It comes up. And I think I hate to say this, but it kind of occurred to me that we're still an overlooked resource. I just saw an article by, I think it was, I want to say it was United Healthcare as a health plan, saying that they were stepping up to share alerts, and something which we do day in, day out and have done for years. And it's just funny since they're one of our customers. So there's a piece of this, which is like, I guess people need to be more aware of what HIEs do. And then, but more specifically for this conference, I'll talk about the automation, how we've kind of integrated into the clinician's workflow and how we've made that easier on everyone.
Sounds great. So once we have everyone's time to shine, we go into the discussion element of it. And there are some questions that could be tossed around. I'm going to go over a couple of them real quick, but then I'm going to hand it off to Dave to close out because he had some great questions as well. And what is the role of AI-based platforms for clinicians at the point of care? These are things that we could just toss out. Once Dave and I might be able to have a conversation over email closer to, and we'll maybe have those draft questions available to you just so you can better prepare yourself. What are the challenges of turning data into knowledge? How does AI insights support the clinical workflow? And what outcomes are you seeing of AI-based solutions at the point of care? So it's really just kind of looking at how is this helping? And remember, take all this into the context of the patient experience. So what are the challenges in order for the patient experience turning data into knowledge for patients? How does AI insight support the clinical workflow? That's how is it benefiting everyone? What outcomes are you seeing of AI-based solutions at the point of care from the patient? And how are these benefiting the patient experience? We're really flipping the looking glass a little bit for some of our content this year, looking more for the patient and how they're, what they're viewing and what they're experiencing with a lot of the content we're putting in. Dave, I'll let you bring in some of the questions that you wanted to consider.
Thank you, Michael. I think those are great questions. In addition to sort of kind of the specific focus that Michael touched on just now with his questions, I'm also interested in sort of the broader context. So, I was mentioning to Michael right at the start of the call, we're always engaged in a series of pandemics. Some just simply rise to the forefront ahead of others at various points. As we hopefully start moving away from the COVID-19 pandemic, there's still the fact that we have an aging pandemic. One of the greatest demographic shifts in history is about to come about. How do you see the work that you're doing fitting into that? And what special challenges might an aging population pose for the kind of transition or transformation that it sounds like you're helping or hoping to achieve? I'm also wondering too about kind of the reality of making a major transition or transformation into improving the patient care experience. When I think about words like artificial intelligence and those kind of things, it sort of brings to mind this kind of futuristic vision. Kind of, for some reason, it makes me think of the idea of flying cars. We've been interested in the idea of flying cars, and there have been prototypes and experiments with them for 70 or so years, and yet we don't have flying cars. What does it take to get kind of from where we are here to some better potential? And how does the current environment, especially with some of the changes that have occurred in the past year or two, we've had the 21st Century Cures Act regarding interoperability and information blocking, all the way to most recently the No Surprises Act, with changes in how patients are going to be charged and the information they're going to be receiving, which is also an attempt to obviously improve the patient care experience, as well as sort of the whole delivery of healthcare. How do those kinds of developments factor in, and are they helping or not in getting us from here to whatever your view of there is? So I'll probably be thinking of some additional questions and maybe running them by you and Michael, but that's kind of my bent, is sort of the bigger picture for some of this in some of the broader context.
That sounds good. And the last thing I'd like to add is if there are any particular questions you would like to recommend, things that you're dying to answer, please send them my way as well, and we can kind of group all these together. Definitely when I say 7 to 10 minutes, try your best to be as concise, but as informative as possible. I know sometimes it's kind of difficult in order to give us this kind of extra time, hopefully 25 to 30 minutes of discussion, to kind of give the folks who are attending this kind of a larger look at the insight that you guys can offer. So just consider that when you're putting together your intro pieces, that we'd love to definitely devote quality time to having you guys offer your thoughts and insight and subject matter expertise on this.
This is Todd. Let me ask David just you a quick question about the pandemic piece. What are you thinking on that? Because we did a lot during the COVID pandemic in New York State from an HIE perspective. Where are you going with your thoughts on that? Is it about getting ready for the next pandemic? Is it focused on the patients or the residents of New York in our case, or is it more focused on the back-end infrastructure, or both?
Well, thanks, Todd. I think you're raising some very good points, all of which could be applicable. I was actually just using the notion of a pandemic as just kind of a metaphor, and the fact that previous to COVID, there have been years and years of policy and other kinds of discussions about the fact that we have this huge tidal wave of an aging generation that's going to be sweeping across the healthcare landscape with tremendous demands for services, coming from a generation that may not be as technically familiar with a lot of communication tools and supports and those kind of things. So I was really just trying to make kind of a segue into the fact that we have this aging tidal wave about to sweep over us. Are there things that you as presenters, with your interests, your products, your development, your experience, are there things that you see that might really apply in helping with that? Are there special challenges posed to the direction that you think the healthcare system should take because of this aging population? So that was kind of where I was going. But in addition, I think you raise a great point, which is, have we learned something about the need for the kind of tools that you're developing to help respond to something like the pandemic, whether it's the current one or any others that may come in the future? I think we've learned a lot, for example, about the expansion of telehealth in particular, coming from the current pandemic. But are there other lessons from the pandemic that we've learned that you think would be helpful for us to be thinking about as well? I think you raise a really good point there.
Okay.
Also, Michael, maybe this is something you and I can discuss, but for our presenters as well, I believe, Michael, we will have the ability, if we wanted to do some polling of the audiences, and then to review those polling results kind of in real time as part of this discussion. So if there are particular questions that it might be useful to poll the audience on, and then to respond to those results, we can incorporate that into the give and take that we have after you've done your presentations.
Definitely. Yep. So if you guys have a particular question and options, please send them to me and we can incorporate them into the session. And if you want to say, Mike, can we go to my poll question? I'll pop it up and we can get some. That always helps with the discussion in terms of fueling thoughts and getting people to really talk. And feel free at any point when you're discussing to play off each other, to, take a point from point person to say, hey, I agree with that, or I see that. We love it when folks interact. We love that kind of discourse. Any other questions? Excellent.
And Michael, also, I assume you and I might be in contact further, and that we might be sending out some further ideas or questions to our presenters saying, what do you think about this? And have you got some other ideas about that, and so forth? Precisely.
And in terms of the housekeeping items, we did mention slides. Slides are due to me that Monday. I believe that's the 26th. So if you have a couple of slides, send them to me. I'll combine them. What we'll do is I'll send a debrief email, hopefully later today, saying thank you very much. Here's the recording, just in case if anything had slipped away. And here's the order I see as I think would be a good order in terms of the intro pieces. And then we have the questions. Dave has his questions regarding aging. We'll work together on that to get that to you. Closer to the event, we'll have hopefully the actual questions that we'll ask. Not to promise we'll get through all of them, because there might be a lot of discussion, and there might be follow-up questions based on your responses that we might not have. So that's just kind of a template, but it's not going to be the Bible. And any questions, Friday, I'll be sending out another housekeeping speaker email, just reminding you of all the things that we're doing in terms of us. You don't have to register. We already have that. We'd appreciate any information or promotion you'd like to give about your involvement with this event to your network. And we've given you the code for a discount for that. So if there's nothing else, I'll give you the rest of your day. Enjoy the rest of the week. And once again, you have any questions or thoughts or concerns, let me know, and I'll discuss them with David.
Thank you.
All right.
Hey, thank you.
Thank you.
Thanks, everybody. Thanks, Michael.
Take care.